Part 3 of the lower extremity muscles on page 365. We come to the text. Over here I've indicated with the letter M the grouping of medial compartment muscles of the thigh, and I've already gone over these with you visually, and I thought I would include this little part of the program here. Remember that we have these basically 5 columns. Everything that's in the medial compartment is innervated by the obturator nerve, so that part is automatically taken care of. And in general, everybody here is involved in adduction. Okay, so adduction all the way down. So that's taken care of. And then it's just a matter of identifying which muscle is where. And that was the purpose of the visual little presentation here. We have adductor brevis, longus, gracilis down the side here, and magnus. Actually, they're showing gracilis over here. And I think they are not actually showing gracilis. Gracilis actually goes from the pubic bone right here, inferior ramus, all the way down to the tibia. So it completely bypasses the femur, and it's a very superficial strap-like muscle here, whereas adductor magnus is massive. Okay, and that brings us then over to the posterior compartment. I'm going to just briefly present here this idea of a sciatic nerve coming down and dividing shortly after it emerges. Let's take a look. Actually, we have a picture over here on page 368 that shows us it because I've drawn it in. Over here we had, remember, the lateral rotators of the thigh. We had piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. And just underneath piriformis and just above, excuse me, above superior gemellus, we have the emergence here, although the artist doesn't put it in, so I have to, of the sciatic nerve. Okay, and it's a big, hunky nerve. It's as big as one of your fingers. Okay, it's got a lot of connective tissue around it, a lot of epimysium, or rather epineurium. You haven't learned that yet, but it's the connective tissue on the outside of a nerve. And so it's this huge thing. And people have sciatica, not surprisingly, because of what's referred to as outlet syndrome. So one of the, more so in women than in men slightly, men are a little bit more having difficulty here because they have more vertical hips. Women have more lateral shaped hips. And so for women, the sciatic nerve pinch between piriformis and superior gemellus can be a little treacherous. And so stretching out your piriformis, and there's exercises for that. You can check the internet for nice yoga stretches that and other types of actions that can loosen up your piriformis, and that will keep your sciatic nerve in much better condition. The sciatic nerve comes out. It does divide fairly quickly into 2 parts, the tibial nerve and the common fibular. Okay, common fibular actually does innervate one muscle of the posterior compartment. Most of the muscles of posterior are taken care of by the tibial nerve. Okay, so that's our program consideration here. And then let's come back over here. Okay, so here we have the sciatic. In this case, I put the tibial on this side, and the common fibular is over here. And I've alluded to where the innervation goes. Fibular is going to take care of the short head of biceps, and then tibial nerve takes care of everybody else in the posterior thigh, everybody in the posterior leg, and everybody in the foot, actually, as well. Okay, and then this branch over here, the common fibular, is going to divide into superficial and deep. And superficial takes care of the lateral compartment of the leg, and deep takes care of the anterior compartment of the leg. Okay, and let's take a look here at the posterior compartment, just the way you like it. And so here we have 3 muscles. And do you see 3 muscle bellies here? You don't see how they're hooked up exactly. And I might turn the page here just for a second to see if they show us. No, they don't show us. But, darn, you could imagine, if you're using your imagination, that there is a way to get muscles up in there. But anyways, so you're sitting. If you're sitting in a seat right now watching this video, then you're actually sitting on the ischial tuberosity. Okay, there's a bony structure that if you're sitting with good posture, not leaned forward and not slumped back in the chair, but sitting with good posture, sort of on the edge of your chair forward a little bit so that you're actually balanced on the bony structure of your pelvis, you're actually sitting on the ischial tuberosity right there. Okay, and that's where all of these muscles are originating, is the ischial tuberosity. Okay, so let's take a look here at the gluteus, and then we have posterior here, biceps. I always like to begin with the biceps femoris, and we have the origin here on the ischial tuberosity, which is crossing the joint of the hip. It's all the way on the hip, the ischium of the ox coxa. And then we have a second head, because it is a biceps femoris, most lateral muscle of the posterior compartment, called the hamstrings, is going to also start on the linea aspera. So it's got 2 heads, a long head and a short head. And then it's going to come together down the lateral side, and it's going to go to the tibia. Okay? And we're going to be innervated here by the tibial nerve. When it comes to the long head, the short head is going to be innervated by the common fibular nerve. Let's take a look at that. Okay. So we're coming down here. Now again, if you're seated, you can actually put your fingers right behind your knee at the soft spot here, and then you can pull to the lateral side and feel a tendon. Okay, do you want to do that? I can put my fingers down behind my knee. I can feel this sort of piano wire little tendon right there. And that's going to be the biceps femoris. It's got the long head going all the way up to the ischium. It's got the short head that runs along the whole linea aspera back of the femur. Long head is innervated by the tibial nerve. Short head innervated by the common fibular. Okay, most of the hamstrings innervated by the tibial. Just this little short head right there is the exception to the rule. Then if you were to reach to the medial side, on the back side of your the soft area of your knee behind there, I'm feeling that now, and I can feel on the medial side 2 little piano wires. The first one that comes to my fingers right here is referred to as the semitendinosus. Okay, this is semitendinosus, and then wrapped around it, especially up here, is the semimembranosus. It's a more flat muscle and sort of wraps around, and it's in second place here on the medial side. So biceps femoris, semitendinous, and sometimes called tendinosus, and then a semimembranosus. Okay, 1, 2, 3. Those are your hamstrings. And we have tibial nerve innervation, just the way you like it. And then we're going to proceed down further, and we're going to get over to the leg, and we're going to take a look at the 3 compartments of the leg. And here we have 1, 2, 3 nerves for the 3 compartments: the posterior tibial, the deep going to the anterior, and the superficial going to the fibular or lateral side. Okay?